Science Technology Society. Latest technologies in dentistry. The Wand, Single Tooth Anesthesia System. Velscope, Enhanced Oral Assessment System. Diagnodent, Caries Detection Aid. The Wand, Single Tooth Anesthesia System. What is the wand in dentistry? The wand is essentially a computer-controlled dental injection. The flow rate of the local anesthetic is controlled by a computer. This means that the injection is guaranteed to be slow and steady and therefore comfortable. For patients. Are you dental phobic? It is estimated that nearly 50% of the US population, alone, experience some anxiety with visiting the dentist. Moreover, 40 million Americans are termed dental phobics, especially children. Persons with such severe anxiety that they avoid dental care altogether. In fact, nearly 25% of all dental appointments because of this phobia. Advantages & disadvantages. Dose reduction. Reduced overall time. Environmentally friendly. Rapid and pleasant induction. Low incidence of nausea and vomiting. Quick recovery. Expensive. Depth of anesthesia can't be judged. Apnea, coughing, laryngospasm. Depresses vasomotor center and myocardium. Poor analgesic and muscle relaxant. Inability to integrate hard and soft tissues. Velscope. What is Velscope? Is a brand new FDA-approved oral cancer screening system that uses incandescent light so your dentist can see abnormalities that may not be apparent or visible to the naked eye. Velscope is also used by oral surgeons to help identify diseased tissue around a lesion and determine the appropriate margin for surgical excision. How it functions? Normal tissue produces fluorescence and appears as an apple green glow. Abnormal, loss of fluorescence caused by epithelial tissue and underlying stromal disruption. Detection. Tissue under normal light. Velscope reveals area confirmed to be cancer. Advantages and disadvantages. Specify area for biopsy. Cheap and non-invasive, disposable. Has high sensitivity for carcinoma. Minimal skills and instruments. Patient compliance. It is distasteful. Sensitivity for identifying dysplasia is poor. The color of the diarrhea in the mouth for 4 to 6 hours. False negative results. Contamination. Diagnodent. What is diagnodent? Tool used for the early detection of cavities. The advanced technology uses sound pulse and laser to detect caries earlier than traditional methods allowed. That treatment can commence immediately, limiting the amount of decay allowed to occur. This helps preserve the maximum amount of natural healthy tooth structure. How it functions? How does diagnodent work? Fluorescence is proportionate to severity. Elevated scale readings. Audio signal indicates value changes. Audio signal allows operator to focus on patients. Case study. Figure 1 occlusal view shows no signs of carious lesions. Figure 2 a radiograph of tooth No. 14 shows no visible carious involvement. Figure 3 subsequent examination with the diagnodent revealed a peak reading of 31 in both the central and distal fossa. Figure 4 the final pre-restorative photograph shows the extent of the operative preparations. Figure 5 post-operative view of the posterior site demonstrates restored tooth. Advantages and disadvantages. It discloses sites inaccessible to other diagnostic methods. The depth of the lesion can be evaluated and scored. Radiography is non-invasive. Approximal caries can be visualized better. Expensive. Does not differentiate between active and arrested caries. Secondary carious lesions associated with metal filling cannot be detected. Time consumption. Presented by Group 2. Asif, Asaf Augustin. Chaudhary, Krishna Awadar. Megan, Dela Cruz Hassan, Fardoza Belahi. France, Nico Di Gao. Ahmed Ali, Bishair. Submitted to Consolation, Luciano.